There are some days when I am glad I had cancer. There are some days when I'm glad I had heart disease. That's surprising. That's surprising to me. It may be surprising to you as well. I'm going to tell you about all the chain reactions that happened when that lead me to everything I have today. So I'm a mycologist and I study fungi, and I also will show you how fungi played a big role in my recovery. Okay, so I was pretty healthy as a kid. We hardly ever went to the doctor. And then in 1997, I got Hodgkin's disease, which is cancer of the lymph nodes. So it was right here. And it was early, and I had radiation therapy for that for 55 days. And the cancer is gone, fortunately. But when they started looking at my x-rays after that, they noticed that I had some heart problems that started to develop 4 or so years later. And I had congestive heart failure with arrhythmias. And you can see this in this echocardiogram of my heart. It's not pumping very well. It's pretty lethargic, and the valves are all not doing very well in here. So at my worst, I was not doing particularly well. So the treatment for that at first was drugs, and then they eventually put in a defibrillator, a pacemaker. So here it is. Here's my x-ray. There's a defibrillator in my chest, and then the leads leading down into the rest of my heart where it works. And so I was fine with that. It was pacing pretty well. My defibrillator was set to shock at 150 beats per minute when I was in a fast rhythm. And in 2004, in August, I had my first time shocks when I was just sitting on the couch, and I suddenly went like this, and then felt myself get shocked. And so it feels like getting kicked in the chest by a horse. So it's not particularly pleasant, but the after effects are, I was more scared that I knew what was going to happen next. They let me take a trip to Colorado, which was probably a bad idea, and I started getting shocked again at 11,000 feet. And so they put me on new drugs and sent me home, and then I was okay for a while, until 2005 when I got necrotizing fasciitis in my foot, which is flesh-eating bacteria, which is not as much fun as you would think it would be. And I do have some pictures, so you can look away if you're squeamish. So here is my foot right before I went into surgery. So you can see the bacteria are oozing out of my foot. It was all over my foot on both sides and starting to creep up my leg. And so I had 4 hours of surgery, and here's my foot a month later with the 4 centimeters wide and 2 centimeters deep, and all of the scar tissue in here that had to be picked out. So I have a foot. Here it is. It still works most of the time. But at that time, they sent me to the Mayo Clinic, and I became the most interesting patient in the Mayo Clinic at ICU. So this is not a good thing, but I did get a lot of visitors. Every single person who worked at that hospital came to my room, I think. So that was fine for a while. I recovered, and I had more shocks along the way. But what set most of it off was that in 2005, in August, I had 37 shocks in one weekend. So I could always tell when it was going to shock me because it has a high whirring sound and then this kind of explosion at the end. And so it was shocking me every 90 seconds because that's how long it takes to recharge. And so they sent me back to Rochester to the Mayo Clinic where we had talked about all the options I had, more drugs, other kinds of things, and decided that what I needed was a heart transplant. So that's a pretty scary thing to hear when you're sitting in a hospital bed. And so, how I felt at the time is pretty well summarized by this cartoon I found much later. For a dying person, a transplant is not a difficult decision. If a lion chases you to a river filled with crocodiles, you will leap into the water convinced you have a chance to swim to the other side. But you would never accept such odds if there were no lion. So I think I don't have to explain the analogy to you, but that's pretty much how I felt. So I had to do a series of tests. Am I a good candidate for heart transplant, or would I be trading one set of problems for another? I did a lot of tests. They took 17 tubes of blood at me at one time. I saw every doctor in the Mayo Clinic except the gynecologist. So after that, they decided that I would go on the transplant list. So in January 2006, I went on the transplant list, and I had to be available all the time. So look at that date there, January 2006. And I waited for that. And this is actually a photo of me mushroom hunting the weekend before I got the call. And I looked really pale in this, and my blood pressure was really low. And everyone who knew me at the time said I looked terrible, but they were kind enough not to say it at the time. They told me much later. And so I waited and waited and waited. And then the phone call came. There it is, I'll get it. And the person on the other line said, "This is so-and-so at the Mayo Clinic. We have a heart for you." And so I replayed that call in my head 10,000 times because that's when everything changed. My whole life changed at that point. And things were going to change pretty rapidly after that. So I wasn't ready. I was terrified. So the first thing I went in my room and I cried a lot because I didn't know what to do. I called my sister in Ohio, and they decided to come up to help me. Some students brought me to the Mayo Clinic. They said I looked like the deer in the headlights when I came out to the car. And they prepped me for surgery. I got there about 3 o'clock. They prepped me for surgery. I started in at 6:30, and by 9:30 the operation was done. And so it's a pretty quick surgery if there's no complications. They're really good at it now. And so I was fine. They induced a coma for 24 hours, and then they made me walk, and they made me get up and walk, and I did. So that was pretty cool. I was actually immediately better. So I was pink again. I had blood pressure, and my heart was beating like it was supposed to. Except for the huge gash in my chest, I was immediately better. And so I stayed in the ICU for about 10 days, and after that I went to the Gift of Life Transplant House in Rochester. Fantastic place. I highly recommend it. And allowed to, well, if you have to. But they have a place to stay, a place to cook your food, a place to socialize with other people who are also having transplants. So I learned a whole lot from other people as well. Went there with a lot of drugs to prevent the rejection of my new heart by suppressing my immune system. And so I have to be very careful because of increased risk of infection. 2 of my drugs come from fungi. And so the main drug I take is cyclosporin. It comes from this fungus that is known to grow on this underground grub. And another drug I take is mycophenolate that comes from a close relative of the blue cheese fungus. So who knew? Right? So the place where most of the advancement has taken place in heart transplants is the Aftercare. And so they did things like check all I had appointments nearly every day for a month. They did things like biopsies where they take another little piece of my heart and check for rejection. I did things like looking for artery blockage and echocardiogram. So actually you can compare my old echocardiogram. This is my old heart that's not pumping very well and very lethargic. And then here is my new heart that's pumping very well. Every part of the heart is participating, and you can see the valves are working really well, and it's going at a pretty normal speed. Here's a different view. Here's my old crappy heart, and here you can see it's not pumping very well. A lot of places aren't working very well, and that was working a second ago, but you can see when it's pumping very well, and you can actually see this is the suture line. So this is actually part of my old heart, and this is all of my new heart. Okay, so it's really interesting that I didn't know until a couple years later. Okay, so I have to be very careful about infections. I wash my hands every 20 seconds. I cook my food thoroughly, and I work with fungi every day, so I have to be really careful about what I do with fungi. And my students in my class have to be careful what they do with their fungi to keep me safe. So they've done a good job so far. Because of the drugs I take, I'm more susceptible to sunburn and to skin cancer. So I've had more than 70 squamous cell carcinomas cut off me in some way. So mostly where I had the radiation. So it's just another thing. Okay, so you get a bill for all this, right? And here's my bill for the first month, which includes a transplant and 10 days in the ICU. And you can see it's around $280,000 just for that. And so this is one reason why health insurance is very important. And I thank you for paying your premiums. But some people, die because they can't afford an operation. So we need to do something about that, I hope. And for all that, you get a certificate. And so here I was number 311 at the Mayo Clinic. So even the Mayo Clinic only does about 30 heart transplants a year. There aren't that many hearts that become available because a person has to be alive when they're for the heart to be transplanted. If a heart stops beating on its own, it can't be transplanted with current technology. About 2 months after I had my transplant, I got to see my old heart. And so I have pictures. There's warning if you're squeamish. My heart's been dissected, so you can see here I am with my dissected heart. So the first time it was pretty surreal. I cried, and it was very strange to hold my own heart in my hands. You can see it's labeled A heart, in case you're wondering. And you can see where it's all stretched out here that it didn't work very well. And so about a year later, I asked to have my heart, and they gave it to me. And so that's what's in this container up here. And so here is my heart. And so don't get to see that too often. Sometimes I wear my heart on my sleeve. But it's pretty surreal to hold my own heart still in my hands. I kind of used to it after all these years, but it's still very strange. So if you're wondering where the heart is, it's in my heart cozy that my friends from Seattle made me. And it's made with wool that's dyed with mushrooms. And then it has a mushroom motif on it as well. And so you can see all the sides of it are pretty interesting with the date of my transplant as well. Okay, so I've often asked if I know anything about my heart donor, and the answer is I do not. They allow us to write to the donor family anonymously, and I have, and it's their prerogative to write back or not. And so far they have not. But about a couple years ago when I had my 10th anniversary of my heart transplant, I wrote a letter to my heart donor. And I'd like to read it to you a bit. Dear heart donor, it has been 10 years today since my heart transplant, which means it has been 10 years today since you died. Thank you to you and your family for the gift you have given me. I know the person in the room next to me received the gift of your lungs, so I imagine your gifts help many other people as well. Your gift helped not only me and your organ recipients, but many others indirectly. Please don't think that I am bragging, but I want you to know some of the examples of what your gift has meant to me and to others. As a professor, I have taught about 1,500 students since my transplant. 15 additional graduate students have finished their master's theses under my direction, and many other students have worked and continue to work in my lab. I have presented at least 100 mycology lectures throughout North America, especially to mushroom clubs and mushroom forays, as well as Malaysia and Slovenia, and I've lectured in 38 states. I have also lectured a couple dozen times locally about my heart transplant, encouraging others to sign up to become donors. I have been able to volunteer and make hundreds of friends at the Blue Stars Drum and Bugle Corps. Your gift has meant so much to so many people. Your gift has made me a better person. I hope that knowing your impact 10 years later has given some solace to your family. Thank you to you and your family for the gift you have given me. So there have been some other benefits to me and to others. I'm a more empathetic person. I can empathize with anything that happens to people, especially students with problems. I've had veterans with PTSD and survivor's guilt. And I don't have PTSD, but I can tell you about survivor's guilt. I know that someone died and I have their heart inside of me. So it took me a long time to reconcile that, but I'm good with it now. I can help other people with chronic or acute problems as well. I can empathize with them, and I tell them there's nothing really special or particularly brave about me. When something happens to you, you just have to do what you have to do to get through it. You do what's necessary, and if I can do it, you can do that too. And so I think that helps some people to be able to talk about their feelings and what what they can do to feel better about what they're going through. I'm also a more open personality. I'm way friendlier than I used to be. I talk to people more. I'm less shy. And a lot of small things don't bother me, things that were small things before. It turns out everything is a small thing. And the big things are important, and the small things, who cares? When my mother grew up during the Depression, and whenever we got some new dishes or new clothes or new furniture or something, she would say, "Save it for good," and put it off in a closet somewhere, or put plastic over the couch or things like that. We were saving it for some good. It turns out that every day is good. Every day is good. I use the good china now. I sit on the good furniture. I wear the clothes I want to. Every day is good. And there's no reason to save it for a good day. Use it now while you can. Okay, so how many of you are signed up to be a donor should something happen to you? That's great. I see many hands up. One thing that's really important is that you have to indicate that on your driver's license or some other way, and you have to tell your family about your wishes. So it's your family, if God forbid something should happen to you, they're the ones who are going to have to decide very quickly whether you wanted your organs donated. So if you have that 5-minute conversation with them, it's a hard thing to talk about sometimes, but if you have that conversation with them, they'll know what your wishes were and what you would have wanted. Finally, the old cliche to treat every day as a gift is true. Who knew? So every day that I have, every birthday that I have, that I'm dreading the big one next year, it's okay. Because every day that I get is an extra one that I wouldn't have had otherwise. So with the thanks to my organ donor and their family, I've been able to have every day with you and with my friends and family, and every day is a gift. So thank you very much.